Vapor cryotherapy. Nitrogen vapor cryotherapy uses liquid nitrogen to rapidly cool the air around an individual. There are three typical methods: whole body cryotherapy, known as WBC, partial body cryotherapy, PBC, and a local application of nitrogen vapor cryotherapy. Specific effects attributed to the whole and partial body cryotherapy are pain relief, especially from arthritis and fibromyalgia, decreased inflammation, increased anti-inflammatory cytokinins, decreased pro-inflammatory cytokinins, norepinephrine release, improved depression syndromes, exercise recovery, decreased fatigue, and improved patient outcomes. The indications specifically for whole and partial body cryotherapy include pain, especially from arthritis or fibromyalgia, inflammation, fatigue, swelling, muscle spasms, and exercise recovery. The contraindications for whole and partial body cryotherapy include pregnancy, untreated hypothyroidism, chronic respiratory disease, severe hypertension, cardiovascular disease, recent stroke, uncontrolled seizure, fever, bleeding disorders, infection, claustrophobia, intolerance to cold, and incontinence. Whole body cryotherapy. Cold air is cooled by liquid nitrogen. This is injected into a cabin or a chamber that may hold 1 to 4 people. The air is typically cooled to negative 40 degrees Fahrenheit, but it may also be cooled to negative 256 degrees Fahrenheit. Some units have multiple chambers at different temperatures. The cryo chamber's air is cooled when the liquid nitrogen is injected into the chamber. Individuals are exposed to cold air for about 1.5 to 4 minutes. Researchers, including Slavic and their colleagues, measured the air temperature in different locations within a cryosauna and the skin temperature of multiple body parts of 12 individuals immediately before and after a 3-minute session. The unit was set to cool at negative 220 degrees Fahrenheit to negative 319 degrees Fahrenheit. This group found that the temperature within the cryosauna varied based upon the location within the cryosauna. This table is the temperature measurements next to the skin during a whole body cryotherapy treatment. A partial body cryotherapy treatment involves the use of a cryo cabin and is sometimes referred to as a cryosauna. This is usually a cylinder that covers the lower body and possibly the torso while the head remains above the cylinder and not exposed to the cold. Partial body cryotherapy units emit nitrogen vapor, exposing the individual to cold. Temperatures range from negative 166 degrees Fahrenheit to negative 310 degrees Fahrenheit for partial body cryotherapy. These tables include skin temperature measurements collected after a cryotherapy treatment session from a non-contact thermometer. These thermal imagings come from the anterior, Table A, from the posterior, Table B, and from a perspective location in Table C. You can see the relative amount of cooling that occurred in different parts of the body. Local liquid nitrogen vapor cryotherapy includes nitrogen vapor cooled air that is directly applied to the skin. This is used to treat local injuries. We typically apply this treatment for 5 to 7 minutes, and the skin temperatures typically drop no more than 89 degrees Fahrenheit. The temperature ranges from negative 256 to negative 310 degrees Fahrenheit for a local liquid nitrogen vapor cryotherapy treatment. The application of whole body and partial body nitrogen vapor cryotherapy. The liquid nitrogen is stored under pressure in tanks. The client or patient removes most of their clothing and ensures that their skin is dry. Male patients typically wear shorts, while women typically wear a bathing suit. Socks, gloves, headbands, and even surgical masks may be worn by the patient to prevent frostbite and for client comfort. Due to the extreme temperatures used, clinicians should ensure that the client's skin is dry and they are not wearing any metal or jewelry. Patients may wear a robe or slippers to and from the sauna or the chamber. When the cryosauna or chamber is ready, the clinician providing the therapy can help the patient into the sauna. For the cryosauna, the patient is raised to the appropriate level, typically shoulder height. The patient then removes the robe and hands it to the clinician. The patient will be in the cryosauna generally between 1.5 and 3 minutes. The patient can raise their arms over their head if the arms are not involved in the treatment. As the patient receives the treatment on a regular basis, often the body adapts and is able to tolerate longer treatment sessions. The most that one session can last is typically 4 minutes. When the session is over, the clinician should crack the door open slightly to allow for nitrogen vapor to release from within the chamber. A robe can be handed back to the client, and the clinician then shuts the door while the patient puts the robe back on. The best evidence for nitrogen vapor cryotherapy. There is a limited amount of weak evidence supporting nitrogen vapor cryotherapy. The evidence that does exist suggests that it reduces restless leg syndrome, rheumatoid arthritis symptoms, and even depression. There is a large volume of data assessing the effects of whole body cryotherapy or partial body cryotherapy on recovery from sports activity. In 2015, a Cochrane review included 4 laboratory based randomized controlled trials that together demonstrated very little low quality evidence for whole body cryotherapy, decreasing pain after exercise bouts. A 2017 randomized crossover design study had similar findings. The whole body cryotherapy did not enhance recovery any more than cold water immersion. We should note that each of these studies used different dosages of the whole body cryotherapy. In contrast, several other studies have found that athletes treated for 5 days, twice a day with whole body cryotherapy at 110 degrees Celsius had reduced pro inflammatory cytokinins and an elevated level of anti inflammatory cytokinins. Additional clinical trials would be needed to confirm how effective whole body cryotherapy is at improving exercise recovery and what the correct dosage of whole body cryotherapy needs to be to achieve the desired therapeutic effects.